So there's two, you can pick of these two you'd like to answer, and then I'll do one final last question, which I think the best way to end this to that point is what you're hopeful about. But first, a couple of fact-based questions here. Do we know anything more about the connection between weather and COVID? And secondly, what's a myth about COVID-19 that you would want to dispel, or what is a misinformation that you would like to take the time that we haven't covered? If you can handle either or both, I'd love to get you all involved.
Who wants to go first?
Go for it.
So one question was the myth, and what was the other question, Dan?
Weather, connection with weather, warmer weather in particular. Earlier on, I think we had this hope that warmer weather did have an impact, but I defer to you on what the answer is.
Yeah, so the data is really mixed on that. We were basing that assumption that warm weather would limit transmission based on, your dog is just adorable and distracting. But so countries like India, Singapore, which are very warm, humid, are now seeing an increase in cases. So I don't think that warm weather by itself is protective. There may be other things that play a role. So maybe in warm weather we're outdoors more, we're not inside as much. Maybe that impacts the number of cases. But weather by itself is definitely not protective enough that warmer states can relax their guard. Myths about COVID. I think the biggest is that it's just the flu, just get it and get it over with. There are other myths like the whole light and heat and things like that, none of which are proven therapies. I think the vaccine is probably our best bet for controlling the pandemic, but that's still several months out. So if anyone's trying to tell you that we'll have a vaccine in weeks, they're wrong.
And the question of myths to dispel.
I would agree. I think the biggest myth to dispel is that it isn't that big of a deal, and that we're overreacting. And we have discussed that, and so I won't go back into that too much, but I would agree with that. The other thing that I'll maybe take the liberty to just throw in before we depart that I want to be sure is included is the aspect of mental health. And May is Mental Health Month, and so it fits nicely here. But I think to keep that on the radar for folks, of both in terms of all of us just who are staying at home and not able to go out and maybe feeling that isolation piece, and so being aware of mental health for the community, but also for healthcare workers, that this is an incredibly stressful, challenging time to work in healthcare. I had a nurse say to me a few weeks ago, I hope when this is all over with, they remember that we need to be taken care of too. And that stuck with me. And so I think, I think about it, especially for those, nurses and healthcare workers in hotspots, like especially in New York. And, we see those kind of clips in social media or on the news, but even in places that are not maybe necessarily hotspots, it is still incredibly difficult and incredibly stressful. And so important to keep in mind the mental health of healthcare workers as well.
Absolutely. Totally agree. We've got to take care of each other's mental health and well-being, and certainly looking out for those who are on the front lines as a healthcare worker, or certainly those who are having to work and being out in the public and having people again. So it's underscoring the importance of we're all in this together, wear a mask. Myths to dispel of COVID. The fact that we're practicing respiratory etiquette, covering our mouth when we sneeze or cough, or washing our hands or wearing a mask, we're somehow losing out on getting some great immunity. Nobody willingly goes and gets HIV to bolster their immunity, or gets, Ebola, or gets any of these viruses or illnesses or tuberculosis that can cause serious health complications, or fatality, even though we can manage these in many respects. You don't go willingly do this for the sake of bolstering your immunity. And I know that that's out there in some circles. And so that is really and I think peddled by some, an unfortunate myth out there. This is a necessary step for us to really try and turn the tide against this, and to say, well, let's just all get herd immunity. Let's all get infected. And that's sort of the unfortunate nature of the passage of time, when we forget, as you said, where were we on March 4th? Where were we on January 4th or February 4th? There's a reason why the NBA suspended its season, and the Masters was canceled, and March Madness was canceled, and all these money-making endeavors were canceled. Because if there was money to be made, there were folks who were going to make money. And the reality is that this is a serious health, public health threat. We saw what happened in other countries. We see what's happening in New York. We see what's happening in Worthington. This has the potential to continue to flare up. And so we're all in this together, and we all have to continue to do our part, or we will undo everything we've done, and all those sacrifices will have been for naught.